so much for joining us today. I'm going to go ahead and let you introduce yourself to everyone.
Awesome. Hello, everyone. I am Dr. Laly Rodriguez. I am a licensed professional counselor here for the state of South Carolina. I am also licensed clinical addiction specialist. I am bilingual, so I provide mental health services for the Hispanic and non-Hispanic population. So I do it the sessions in English and Spanish. And I am in Columbia, South Carolina.
Okay, thank you so much. And again, thank you so much for joining our new thing we're doing called Real Conversations with Real People. So let's go ahead and get started. Tell me about the importance of caring for your mental health.
Awesome questions. It is my pleasure to have the opportunity to share a little bit of mental health. What is mental health? Okay. Physical and mental health, both are equally important. So it is very important for us to be aware of knowing that we need to identify what is going on from the mental health aspect. When somebody is mentally ill, is not able to perform any job. So we need to understand that both are equally important. It's also important to neutralize the reality, what is happening right now, with what we believe in our mind that is happening. So that's why I really like that question. That question in particular.
Okay, perfect.
Okay.
And you know, mental health is a big subject. It's a little bit hard to talk about sometimes, and I know there are a lot of false information out there. And yeah, even though we're in modern times, it's still quite difficult to talk about it. So can you tell me a little bit about some of the false stigmas that come with talking about mental health, and just a little bit about that?
Yes, Maria, and I think that's a great question. Unfortunately, stigma is very linked to mental health. And I think that us as a society is a responsibility to re-educate and remove the stigma. It's not an easy thing, but we were the responsible as a society to create a stigma like you're crazy because you are going to see a mental health professional or a psychiatrist, or some people feel uncomfortable because they feel that they are going to be judged. It's a lot of judgment that are around mental health, unfortunately. Some others are afraid that because they go and see a psychologist, they may not be able to obtain a job that they have or they want, especially if it's with the federal government, for example. They feel that that is going to affect their career. You know, so I really feel that it is a responsibility to start re-educating and understand that go and seeking help for a mental health professional means that you are responsible enough to take care of that aspect. If you're sick, if you have something in your teeth, you go to the dentist immediately. But when you start feeling funny, like people say, or different because you feel like sad or some symptoms that you don't usually feel, you don't feel comfortable in going. So I feel it's a responsibility to re-educate and say, go and check. So now that we have this opportunity to educate, let's work with the small one. Let's talk about mental health, like something normal, because mental health is normal. It's just part of us as humans. So we need to start re-educating in order to remove the stigma, if that answers your question.
Oh no, that's amazing. Yes, because you know, me personally, I do love talking about mental health, and that never stops me. But there have been conversations I have with people, and they're like, oh, but I don't need to go to a therapist. I'm not crazy. Or, oh, no, like, you don't need medicine for that. You just need to go outside. But it is important for everyone to know that, you know, if you have a cold, you take cold medicine. If you have something going on in your mind, you just need medicine for it sometimes, and that's okay.
Yes, so I think, and I really hope that this opportunity that I'm having help me to put a little bit of, see it, that it's important to re-educate our society.
Yes, of course.
Okay.
So speaking of education and just, you know, mental health in general, I know that right now with everyone being quarantined, that's made it really hard for everyone to just function and get adjusted. Are there some ways to take care of your mental health during quarantine?
Definitely. First, during this quarantine and any quarantine, what we have to do is just, of course, follow the guidelines of social distancing and, washing your hands in this particular case. So I want to make sure that that is the most important thing that we need to do. However, this situation brings other issues to us because the human being first, during the quarantine, we feel like we are out of control. We have no control of things. We need to be inside. So this is a big change. Besides, it is a big change. The interesting thing with this is that it's new for us. Nobody knows anything about this. We are all learning during this process. So of course, this is going to increase the anxiety. So my recommendation for this, after following, of course, the guideline is to first get in contact with you, know yourself. Understand that this is a process that all as a community are living, right? Avoid watching too many news, okay? Everything that you do, an extreme is a problem. Even love, an extreme is a problem. We need to have a balance. It's important that we watch the news because we need to be aware. But it's also important to know when those news are too overwhelming for us. So my advice is watch the news, the official news, not every news, but do it not an extreme. Go and learn about it, then do something else to do balance in your life. You can read, you can write, you can do yoga, you can do meditation, the most important thing to do is just to know what's going on inside of you. Feel it. Give the opportunity to feel all of that. Don't try to avoid the feelings that you're having, feeling uncomfortable, feeling afraid, any of that. But use this time in the proper way. Spending quality time with those that you can because you are spending the quarantine time. Also, have the opportunity to maybe do stuff that you haven't done in a while, or maybe new things that you don't know that you are capable of doing it. Use this time for that instead of feeding yourself about information that unfortunately you cannot control. So I feel that those are the advices that I can give during quarantine.
Yeah, that's amazing advice. And I think it's very doable for everyone. So yeah, that's amazing. Thank you. Talking about healthy coping mechanisms, can we talk a little bit about what unhealthy coping mechanisms are and what those can look like? I know that sometimes some things may seem like they're a good thing because they make us feel good, but it's not the correct way to do it because it won't help in the long term.
Yes, and I have to say that I'm very impressed with your questions, with the question that you developed. They're very, very good questions and are going to give me the opportunity to really give good hints. So, answering that question, unhealthy coping skills, I have to say that all human beings at some point we have used it. Why is that? Why we do the unhealthy? Because give us the immediate kind of comfort that we want. For example, again, everything in extreme is a problem. I am not talking about giving a glass of wine, have 2 glasses of wine, have a spirit drink that you enjoy. There is nothing wrong with that. When you do it in extreme, and when you do it to numb the feelings that you are trying to avoid, that is when the problem comes. So for those that are drinking too much, and you know what will be too much, I just invite you to change those strategies to do something healthier. For instance, as I mentioned before, listening to good music. Maybe we didn't even know that we like that kind of music. And it's a lot of apps that we can use and we can change. Why is that? Because for people that have been using unhealthy coping skills, tell them just to stop. It's not going to work. That's setting for failure. So I would say instead of do that, try different drinks. Let's say that you like to drink too much. Have the bottle of something because you need to have something because your brain doesn't know that you're changing. But do something fruity. Do something that you know is going to help you with your health. Change it, but don't leave it. Just change it and for something else. Same thing with drugs. of course, we know that we cannot use any kind of drug for all the consequences. And that would be another topic that I can go in details, because addiction is just part of my specialties as well. Same thing, I also have a lot of people that have been addicted to pornography, because that at the moment is going to give you like an instant pleasure, but at the end is leading you to a behavior that we don't want, because it could damage. How we know that is too much? How we know that we are addicted? Always ask yourself if you don't do something that you have to do because of doing that. For example, that you are supposed to work the next day and you don't go because you're hungover, because you were drinking too much. Those are the questions that we ask to know if this is too much. But having a glass of wine in the afternoon, that is nothing wrong with that. Again, balance.
Okay, so just to make sure that I am fully understanding and that it's clear, just particularly pertaining to drinking, if that is something that you do in excess, are you recommending, like, for example, changing it to tea during the day and then just having your glass of wine during dinner? Because that's fine, but change it to some tea or coffee, soda, water, anything else, just to give you the, still the I'm drinking, it's just I'm drinking something that's good for me.
Exactly.
Okay,
And
perfect.
also internalize, because the human being needs to understand why they're doing that. I mean, you don't do stuff just because. So I like the way that you say it, because this tea is helping me better than, having the alcohol. But at the same time, that person will know that we'll have the glass afternoon. So I like that idea, and I definitely agree with it.
Fantastic. Thank you.
You're welcome.
And yeah, no, definitely. Oh, and you covered our question about alternative healthy coping mechanisms. So, 2-for-1 answer. That's so good.
Yeah, and maybe the way I did it, and I want to clarify that, is because it's very important to understand that when somebody is abusing or addicted to something, you cannot change it without giving another option. So I probably, and I have the tendency to give you, okay, this for this, instead of leaving you like, in air. So that's why I went ahead and answered that one.
No, of course. And I think that's fantastic. I think it is definitely more doable to kind of replace an unhealthy habit with a healthy habit. Just being human, I understand how hard it can be to just stop something completely, but finding alternatives and finding just ways to adjust definitely can make it easier.
Yes, it does indeed.
And you are a healthcare professional and you have all this amazing advice. And we were talking a little bit about the stigma that comes with going to therapy, but can you just talk a little bit about what are some important reasons why it's important to seek therapy and how to find a therapist or mental health professional that's right for you?
Yes, what a great question. And this is something that people need to take it very seriously. When you go for a therapist, of course, the first thing you need to do is the credential, because you need to know that that person is indeed prepared to give you the help that you need. However, we are all humans. I am a human being. I just picked this field. Somebody else pick another field. So it's very important that when you go to that room, you give the opportunity to really know and ask questions to your therapist. Remember, you are going to open your heart. You're going to go and be internally naked in front of a person that you don't know. So of course, and culture play an important role as well. But since you do the first step and go and check for therapist, make sure that you are connected with that therapist. Check that therapist first have the areas that you are looking for. Let's say that you're looking for addiction. Make sure that that person has the addiction expertise, because we as counselor, we have the whole thing, but then we have specialties. So it's very important that that person has that. Also, trust your gut. You will know once you sit there, maybe 1 or 2 sessions, you will know if that person is the one that is going to help you. Eye contact, the energy that you feel in the room with that person. And if it doesn't work, don't feel bad. Go and look for somebody else, because if that person is professional, will understand that it was not a chemistry there. That didn't work. And let me tell you, I've been doing this for almost 20 years. And if you are not connected with your counselor, it's not going to work. Still are going to do the process, but it's not going to be as effective when you feel connected with a therapist. So take your time. And if you don't like it, no problem. Go and find somebody else until you find it. And you will feel it. Once you get to that office, you're going to feel that that's the person that is going to walk with you to the beautiful journey of therapy. All right? So very important. Trust your gut.
No, and I really appreciated that you mentioned that, therapists are professional and you're not going to upset them or disappoint them because they just didn't work for you. I know, especially me as a people pleaser, I have a hard time with just being like, oh, sorry, no. So, knowing that, I hope can give a lot of people peace of mind, and knowing that it is okay to kind of shop around for your therapist.
Perfect. You use the right words, because sometimes we take a lot of time for a pair of shoes, but then we go to a therapist. She's all right, but no. She's not all right. It's not all right. You need to love your therapist. You need to feel that every time you go there, it's a massage for the soul. You need to be looking forward for that, and don't see that like, going there. No, that is not how you are supposed to feel with your therapist. Okay, so always be aware of that.
Oh, fantastic. And I mean, we discussed a lot of subjects. Is there anything else important that we haven't talked about that you think it's important for everyone to know?
I really believe that every single human being should go to therapy at least once. Why is that? Because the human being goes through a lot of changes, positive, negative, and all that. And like a car that needs to go for a tune-up, we also need that. And it's going to help us to really understand us, understand why we behave this way, understand why we are acting that way, why this is always happening to us. It is a lesson. So it's so many things that we need to comprehend about ourselves. My philosophy is that every single person is expert of their own life. You know what works, you know what doesn't work. But it's important that you go, do a checkup, see how you are. And if you feel that is beneficial, that is helping you in some way, continue. If not, create the probably the routine of doing it at least once per year. I mean, it is a wonderful journey. And I'm not only saying because this is what I do, but I believe as a patient that I was at some point, and I still, because I have my therapist, is very important for self-care. So my recommendation is, please make an appointment one day, go and see a therapist, see the beautiful of a massage in the soul that not many people have the opportunity to have. Invest in yourself, because at the end, you're going to have to live with yourself for the rest of your life. So try it. That would be my advice for everybody.
I love that. And then just so I can further understand, are you saying that you don't necessarily need something big or traumatic to happen in your life to go to therapy? Just moving somewhere or getting a new job and just even everyday stresses, those are reason enough to go to therapy.
Definitely. And every human organism that is alive, I mean, every single person that is alive have going through any changes. Even changes from college, from high school to college is a change. Moving, everything it is. And you will understand so much about you. It's just going having a physical every year, because a lot of things happen in our body. It's the same thing mentally. But because we don't take care of that and we don't go there, that's why, unfortunately, when some patients come to us, it's a crisis. And that's what I would like to avoid, that you get to a crisis, because you took care of that when that was at the beginning. Like any illness, when you catch it at the beginning, you have higher possibility of getting better. So that is my recommendation. Do a checkup. It won't hurt, but it's worth it, because you work with this, you live with this.
Well, thank you so much for your time. I really appreciated everything you had to say. I know that, everyone that's going to watch this is going to learn a lot about mental health and therapy. So thank you again so much for your time.
You're very welcome. Thank you for doing such a great job. And anything that I need, that you guys need from me, know that I can be there and, give like a class or tips, strategy, anything for my people, because this is why I went to school. Okay?
Thank you so much.
Blessing for you guys and a lot of good energy.
Thank you.
Be safe.